So, hi everybody, I'm Jane Finsale, I'm the Chief Exec of Working Families, and I'm going to be the host for the next hour. I'd like to extend a hugely warm welcome to everyone here today, to our members and to those who aren't members yet of Working Families. We've delighted you've joined us for today's webinar on workplace fertility support in partnership with Fertifa. Our latest Working Families benchmark report, in which 77% of our participants offered support for employees going through fertility treatment, clearly showed that an open, supportive working culture where people feel able to discuss their journey to parenthood with their employer is vital. So this webinar is very timely, and we're delighted to be here with the real experts on this, so that you can leave today ready to get started and build a business case for workplace fertility support in your own workplace. So here we go, and I'm going to ask the panelists to introduce themselves. And I'm going to start with Eileen, who's going to talk to us a little bit about Fertifa and their start in the world. So if I can move over to you, Eileen, that would be great.
Super. Thank you so much, Jane. It's really a pleasure to be here. And on behalf of the entire Fertifa team, I just wanted to say we're so pleased to be co-hosting this webinar with Working Families. We're so grateful for all the advocacy and the work that you do, your team does, underpinned by all the research and, importantly, the quantitative data in support of working families, because I think we all know that that's what's really needed in order to actually impress any kind of change, to get that data. So before we hear from Hortense and Gaia, everybody else who brings the actual working experience and making a business case to this conversation, I just wanted to offer a little bit about my role and my personal perspective. In addition to going through 3 rounds of IVF myself while working and lamenting the fact that I didn't pursue preservation of, freezing my eggs when I was younger, I am presently the exec director at Fertifa. We are the UK's largest fertility benefits provider, and we also offer menopause and men's reproductive health support as well. So for those who may not be familiar with us, we were first established in 2019, and we now have clients such as Hortense and Centrica, but we also work with the likes of Facebook, Meta now, I'm never going to get used to that, by the way, Virgin, DHL, and many other companies of all sizes. Our mission is to ensure that workplaces can offer fertility or reproductive health benefits to all of their colleagues in a really inclusive way, regardless of sexual orientation, relationship status, and of course, age. Through our clients and our network of partners, we reach more than 100,000 employees in the UK. And we're so pleased that events like this are happening more and more often, which means we're finally starting to address and normalize the conversation. So we're getting somewhere. And finally, just to clarify, I've had the pleasure of working with Fertifa since late 2020, but was actually first introduced as an investor director as I'm a partner at one of the UK's VC funds, Passion Capital. And so as part of that role, I sit on the boards of a number of SMEs, including Monzo Bank and others, but I'm also on the board of Currys PLC and do quite a bit of work with public-private sector partnerships too. So as you can imagine, I think about ROI and business cases day in and day out, and sometimes in my sleep. And for me, there's such an obvious business case for fertility benefits. That's why I'm so glad that we're having this session. I'm really, really pleased again to be part of the conversation. And I just want to thank you, Jane, and Working Families again for having me and Fertifa here. Shall I pass over?
That's absolutely brilliant, Eileen. As ever, I was desperately searching for the mute button. So thank you so much for that introduction and for talking to us. Fascinating to hear you're on the boards of all of those organisations. And thank you. And 3 rounds of fertility treatment while working. That's pretty amazing. I think you're definitely my nominee for International Women's Day of the Year following that. So I'm going to introduce the rest of our panelists. We're going to start with Hortense. Hortense is going to speak for around 8 minutes. And while each of our panelists is speaking, the rest of us are going to mute ourselves and close down our cameras. So Hortense, I'd love you to start by introducing yourself. It's so great to have you here with us. Thank you.
Thank you, Jane. Thank you for having me, and it's as always a pleasure to talk about fertility and and try and empower people to do the same as what we've done in Centrica. So I'll share a bit about my story and what we have in place at Centrica. So I'm a procurement business partner at Centrica. It's nothing to do with fertility, nothing to do with HR. It's my own personal experience that has led me to sort of be passionate about offering more support for me and my colleagues, and sort of drive the business case. So hence I always say that, you know, if I can do it, anyone can do it. You don't have to be an expert in HR benefits or anything like that. It's just something that I was passionate about and started talking to my colleagues and our senior executives, and they saw the passion that I had and the benefit that it gives everyone at Centrica to have fertility benefits. So what we have actually in place is what I created about 4 or 5 years ago is what I call a fertility sanctuary, which is a very informal network between our colleagues. I should have mentioned, by the way, that Centrica is an energy supply company. So we're quite a large organization. Currently, we have 18,000 employees in the UK and Ireland, but also other teams across the world. And so it was for me the opportunity to create a network that is mostly digital. It's like an online social group, which I used to share my story, my personal story, and opened up to others to join. And it was overwhelming to see how many people actually joined the conversation and wanted to share their own personal story. And so basically, the Fertility Sanctuary is a very informal place where people can chat, ask questions, share their experience, get support and empathy. But as a result of that network and seeing how much appetite there was for more support, we actually have developed more offering for our employees. We already had, at the time when I created the network, there was already a fertility policy and paid leave. We have 5 paid leave. But what we've added to it was the partnership with Fertifa, which really offers a confidential and sort of more medical aspect to answer questions that people may have, considering their own background, their own personal medical history, etc., which we couldn't do in an informal network. And so through Fertifa, we also offer 24/7 kind of support and consultations, and then also free home fertility test kits, which are selling like hotcakes. And obviously because they're free, but also because it really shows the interest that people have. And we really wanted to encourage people to look at their fertility, maybe even earlier than they would have expected to start thinking about it, just to incentivize them to really get going in thinking about their plans and, you know, making sure that everything's okay, that they have that option to have a natural birth. But if it was the case that they can't really, and they need to look at other routes, then they have that support through Fertifa. So we also have built employers and managers and employees toolkits, which I've built myself with the working group that we've set up. And this helps sort of guide conversations and points people to what's available, the policies, and navigate the difficult conversations they might have between themselves. So this is what we have. How I decided to implement all of that and sort of push the business case for it was really my own personal experience. Unfortunately, I had a tragic sort of discovery that I was infertile following health issues and was very depressed about it. But bizarrely found a lot of support and comfort through my colleagues when I started sharing my story and talking to people about it. And so I found that we should really tap into this wealth of support and empathy by creating a network so that people can sort of buddy up and help each other through tough times. And then gradually people wanted to help as well. And so with the working group, we sort of pushed the agenda and made it more made the case for more support. And it kind of is a slam dunk. It's such a straightforward thing to have as an employer, because the loyalty that you're going to get from your employees and the recognition from, you know, that we care about them is very clear through that business case. And so attraction of talent and retention of talent is the main benefit you're going to get, and employers definitely do get that. So I think the impact that I can see from the feedback on the network and what people are sharing when they're sharing their story or telling us, how they feel by joining the network is completely overwhelming. I had very, very intense emotional moments, because when people open up for the first time in many, many years about their own experience of infertility or miscarriages, it lifts a big weight off their shoulders, but it opens up a whole, I think, environment of caring and empathy, and that is, I never expected to have created that when I started the network, but it's very present in the group. So just knowing that you have that group, that you have the opportunity to share with colleagues and get answers, or be just telling people we've just had a really tough time and miscarried, or IVF have failed. It's really, really important to be able to open up to somebody. I think we shouldn't have to keep it to ourselves. And sometimes it's really hard to share with families or friends. So why not share it with your colleagues anonymously? We also offer that option, so people can share anonymously questions or just messages, and they get a huge, volume of answers and sort of either likes or support or commiserations when they have had a loss. And so all of that is very, very important to me. That's the biggest benefit of it all. But at the same time, we also highlight where there are gaps in our current policies or ways of working and teams where managers aren't so supportive or aren't really understanding the policy or applying it. And so it really helps give feedback to the employer, to our company, to show where they can improve and where things can be changed for the better. And so all in all, it's really empowering people in our organization to grow families as well as careers, and really put that focus on, you shouldn't put your family on hold because you want a career. And hence we're incentivizing people to start looking at their hormone levels and their the status of their fertility journey sort of thing really early on, by free home fertility test kits for both men and women, for themselves and their partners, which they can do in the comfort of their home through the post or using an app. And it's really, really practical, very useful for people to have. So the next step really will be to offer the financial support. Is the offering to pay for people's treatments would be really amazing for me. That's my goal, my challenge that I want to achieve, and the legacy that I want to leave at Centrica, because I think that makes sense. It's quite complex in terms of implementing it. It has tax implications and things like that, but it's so much worth it. So that's what I'm hoping to be delivering soon. Hopefully that's my time.
It's absolutely perfect.
Thank you.
Thank you so much, Hortense. That was fascinating, absolutely amazing what you've been able to achieve at Centrica. I find this whole thing fascinating. 30 years ago now, a girlfriend of mine left her injections in my fridge. I thought they were a box of chocolates. I didn't quite understand why she was leaving boxes of chocolates in my fridge. And then 16 years ago, friends of ours again had some fertility treatment, and I'm really pleased to say in both cases it was successful, but it's something that's been happening for such a long time. And for me, what's really exciting, and maybe exciting is the wrong word, but what's really encouraging is that so many people are talking about it now. And it's such a tricky and difficult subject.
It's absolutely hard to even come to the idea that you're going to share such a personal thing with the world.
Yes.
But even with just one person, it's that first step.
Yep.
And we see in our network that a lot of people use that anonymous feedback because they can't make that first step to actually know who's hearing their story. So it's a bit easier initially, but it's yeah, it's a big step. A lot of people really find so much comfort though, so they're so relieved afterwards that they can see that in the chat, and so that encourages people to do it.
Yep. It's extraordinary, isn't it? Getting support from other people is really helpful. So I'm also delighted now to introduce from Thoughtworks, a leading global technology consultancy. We have Gaia and Liv, who are going to be talking to us. And Gaia, if I can welcome you first to this webinar, that would be lovely. Thank you very much indeed. And again, I'll pop up in 8 minutes. Okay, thanks, Gaia.
Thank you so much, Jane. So as you have just heard, hi everyone, my name is Gaia Miraglas and I'm the People Operations Generalist here at Thoughtworks, and I'm joined by Liv Harrison, our Performance Management Partner. We're really thrilled to be here and to tell you a little bit about the work that we've been doing here at Thoughtworks. But first, just to tell you a little bit about our business itself, Thoughtworks is a global tech consultancy. We're made up of over 10,000 employees across 17 countries. More specifically in the UK, we've got just over 500 employees. Thoughtworks is a cross-functional team to help our clients create their own path to digital fluency and to build organizational resilience, whether that's through our strategy, design, and of course, software engineering. And beyond that, we're really super passionate technologists who are committed to driving inclusive and responsible tech. And of course, in the same light, we're really passionate about our people.
Thanks, Gaia. And as we know that around 3.5 million people will experience fertility, will be on the fertility journey and experience fertility losses. So what we wanted to try and understand within Thoughtworks is what can we do to support our diverse workforce, whether that's looking from a gender lens or whether it's looking from what we've heard previously from different people that have shared their experiences. How do we take that information on board and we create something that's inclusive across the workforce? So hence that brought around our fertility policy that we introduced in February 2021 prior to the pandemic. And what the fertility policy really aims to do is look at the more common types of fertility that we know our thought workers are experiencing. So this is looking at attending fertility testing appointments. We provide half a day, regardless of whether you're the person going for the testing or you're supporting the person who's receiving the testing. We provide half a day paid leave to attend that. And then also fertility leave. For those colleagues that are undergoing IVF or IUI treatment, we offer 10 days paid leave. For the partners of folks that are experiencing those treatments, we offer 5 days paid leave. And we hope that this offers the flexibility to be able to provide some comfort that they're not having to take annual leave and that they're able to follow this very intense, very emotional process with the comfort of knowing that Thoughtworks is behind them and supporting them every step of the way. And then with our colleagues who are unfortunately experienced miscarriage, we wanted to really ensure that our fertility policy included them as well. So for the individual that experiences it themselves, we offer 10 days paid leave. And for the partner, who is often the emotional anchor for that person, we offer 5 days paid leave. Then I'll hand back over to Gaia for adoption and surrogacy.
Sorry, just quickly answering a question in the chat as it popped up. So we also wanted to just cover adoption, surrogacy, and a lot of the work that we've been doing, which has really kind of been driven by our partnership with working families. And we did a massive kind of review of our suite of family-friendly policies. And I can tell you about some of the critical changes that we've made. First off, employees are now will now qualify for enhanced parental leave. So at Thoughtworks, we offer full pay for 26 weeks. If at the end of the qualifying week, they've been continuously employed for 26 weeks. Previously, this was 12 months, and we feel that now with the change to 26 weeks, it means that parental rights are even more accessible to newer employees. Secondly, we saw that our policy was previously quite restrictive in its 12-month qualifying period for enhanced leave. So where an employee had adopted another child within a 12-month period, they wouldn't be able to qualify for the enhanced pay. As an organisation, we really wanted to be supportive of family planning, and for that change now means that our policies no longer have a restriction in terms of the qualifying period. Thirdly, it was important for us to ensure parity across all of our policies in terms of the time off to attend appointments. So whether that's for antenatal, adoption, or surrogacy, we saw that our maternity and paternity policies offered reasonable paid time off to attend appointments, whilst our adoption and surrogacy policies limited these days to 5 days for the primary adopter or intended parent 1, and 1 paid day for the secondary adopter or intended parent 2. We're pleased to now say that our policies now offer aligned reasonable paid time off to attend appointments for both the primary and secondary adopters as well as the intended parent. We've also made it very clear in our policies that time off in case of surrogacy would also include the court dates to obtain the parental order.
So talking about why did we introduce the fertility policy, we are a very inclusive organisation and we're very open to educating ourselves and learning from others. And with that, we regularly ask people to share their personal and professional journeys. So I decided to share my personal fertility journey on what we call a speaker's corner, which is an open 30 to 45-minute forum where somebody talks about a subject and we educate ourselves on that. So I spoke about, unfortunately, suffering from miscarriages. And I was really astonished to find that quite a lot of colleagues had also suffered in silence, I'm sad to say, had experienced similar, and none of us knew what support we should get or what we were entitled to have. And I didn't really take any leave post the miscarriage. I took the medical leave that I needed to take, but I didn't really think about my emotional and psychological well-being. So with that, we knew that we were hearing from folks and we knew that we really needed to make some changes and look at what we were offering. So we created some focus groups to really hone in on what is it exactly people are needing and what is it that we should be offering, looking at both external market offerings and internally, what can we afford, what can we support. So we introduced 6 focus groups to try and keep them nice and small and very intimate, where people opened up and shared their personal experiences. And that really helped us to shape the fertility policy and really create buy-in from the senior leadership team too, was really imperative. And with regards to the buy-in, we asked our CEO at the time to really help us drive the fertility policy, as we know it's one of our very key policies that will help not only with loyalty, but will help people be their full selves when they come to work. So when we looked at what we were introducing, we heard from an array of people about the different fertility journeys they'd been on, but the common themes were support with IVF, miscarriage, and fertility treatment. And that's why we decided to create the policy in the way that we did. And then how we communicated, what we did next was we shared with the whole organisation in the UK. We shared on a town hall, which is a UK-wide update, and we shared via email as well. So for those learners that need to read through the comms, especially because it's so emotive, we wanted them to take the time to really digest what we were introducing, as well as be able to answer any questions in live time from the town hall. We then went back to our senior leadership team and asked them to familiarise themselves with what's being introduced, ensure that they're comfortable with answering questions, and they then are champions to be able to speak to the wider business about the fertility policy as well. We have a mental health and wellbeing hub that we direct people to just to help them, get support with their mental health, especially when they're going through quite tricky experiences like this. And then I'll hand back over to Gaia to share the feedback.
Thank you. So just wanted to share some of the feedback that we've had from our employees since we've launched our fertility policy first off. And it's really been such a privilege for us to be able to support a number of employees on their journey. And we know that from the feedback from those that participated in the focus groups, it's made such a massive difference to their families during what's a really challenging and emotional time. One of our long tenured colleagues who had been dealing with fertility issues for many years shared with us just how overwhelmed they were with the ability to have paid time off to undertake IVF treatment as well as having time off to recover afterwards. In terms of the changes to our parental policies to employees that were already on parental leave that had been affected by the reduction in the qualifying period or the removal of the qualifying period between pregnancies and adoption. This meant that employees had an additional allowance that was paid to them in the same month that the policy was published. And we got great feedback from the affected employees just about how overwhelmed they were. And it included comments such as it was a reminder about why they love to work here at Thoughtworks.
We know that it's the first iteration of our fertility policy. It's still quite new. It's only really been in around for a year. So we want to keep iterating. So we're continuously asking for feedback from our colleagues on what's working, what's not, and they're sharing that with the people team as they feel it's a very confident and comfortable space. And then we're going to look at what's missing. And it's great to hear from others around what you're doing so we can understand what's out there, because when we did a lot of our research, we found that it was quite limiting to what we could access as an employer in terms of resources and support. So it's great to know that there's more things that are available on the market. And then we've always been committed to driving our LGBTQ plus inclusion. And this year, we're really proud to be in the top 50 for Stonewall's Workplace Equality Index. And we want to continue to look at how we make the policies even more inclusive beyond the traditional policies. So, for example, how do we support same-sex couples navigating the complexities of starting a family and ensuring that they're able to enjoy their work-life balance as well as their personal life balance. Thanks so much.
Thank you both so much. That was absolutely fascinating. It's amazing what organisations can put into place to support their staff teams. One of our consultants uses this fantastic phrase that we shouldn't be talking about human resources, we should be talking about resourcing humans, which I think is a wonderful way of thinking about it. And it's so great to see all of these extraordinary things that you're doing. Liv and Gaia, thank you so much for sharing that with us. We do have time for some questions now, and we've got some questions in our Q&A, which is what I'm going to be going through. One of the brief notes that I just wanted to add was that from our benchmark in 2021, the types of benefits employers might provide for people going through fertility treatment, and I think these have actually all been mentioned, but I think it's worth saying again, paid time off for people to attend and recover from treatment. This really big emphasis on peer support groups and networks, buddying systems, resources for managers, employees, and in some cases, access to financial support or private medical insurance to contribute to the cost of treatment and counselling, mental health support. Many employees undergoing fertility treatment also benefit from a period of flexible working, which might include home working. So I'd like to invite Gaia, Liv, Eileen, if she'd like to, and Hortense, to come back onto the screen so that we can answer these questions. So the first question is very specifically for Hortense around how do colleagues take part anonymously?
So basically we use the Microsoft applications for our organization. So that's made it really easy to have just one, what we call Teams group. So this is one of the apps from Microsoft. And it's kind of like a bit of a project group, but at the same time, it's very flexible. You can make it completely public so that anyone can join. What's really cool about it, if you're a bit of a geek like me, is that you can actually build things around it, automate things a little bit. So it's a self-sufficient network because once you join, you automatically receive an email from me. So it's like a flow, what they call process flow in the background that happens. So it recognizes your email and then sends you an email automatically on my behalf. And in the email, I say welcome. I put lots of links to the support available, a video, an actual welcome video from me. If they like, so we try to tailor all styles, so video, or you can read something, or you can start interacting with people. And so it's a very digital only, and hence it was straight away, picked up by everyone across the world in our organization. We had, groups in the US, in Ireland, even our third parties in South Africa or India were actually participating. So it's not just for our employees, it's also for the people that work with us that are on our network. And also one of the questions was about how do you post anonymously? Actually, this is another call, flow, which it's just a simple form that people sort of put up the link to a form in the group, and people can fill it in, and that automatically posts something, the actual message into the channel, the conversation channel, but without their name on it. So it removes their name, and it shows as if I'm posting it on their behalf. And so that enables them to really post something. And a lot of the time people come to me personally, like in a direct message, to also give response to that. So when, for example, they've posted an anonymous post and they've had a lot of support, a lot of responses, they often come back to me and then say, on my behalf, can you actually thank everyone for the support? And that's how we do it. I would recommend try yourself and see if you can use those apps, because they're really cool. They're really helpful.
That's absolutely brilliant, Hortense. Thanks very much indeed for that response. One of the questions we've had from our audience is they're very interested to understand how the free fertility testing works and how the business absorbs this cost, and what is the uptake from colleagues. And I think that's over to either Gaia or Liv.
I can also share some of that if you want.
Brilliant.
From the experience at Centrica, because I can see they're still muted, but basically it's a cost of about £100, I think, per kit. And so for that's the basic home fertility test kit. And so it's just a form that people can fill in and place the order, and it's free. So it goes directly to their home address or whatever address they put in. And how it works is it's a very, very sensible business case, because it's such a little investment for an organization. The take-up has been, well, I mentioned earlier, we have over 18,000 employees. But actually, I think we've gone over the 100 kits delivered in just a matter of a few months. So it's only, we launched only less than a year ago. And the take-up straight away was huge. When we were advertising it, and now it's kind of sort of slowing down a little bit, but it's a seasonal thing as well, because people look at their fertility options or their plans usually at the beginning of the year, or there's like different times of year that people would do that. Over to Liv or Gaia if they want to add anything, or Aileen.
Hortense, while they're thinking about that, if they'd like to, one of the things that the question was also around, how does the business absorb the cost? Do you happen to know how much the test kits cost?
Yes, it's about £100 per person. So you kind of build an assessment of what was the percentage likelihood of people taking it up. And that's the same approach for the overall business case, really, for paying for people's treatments, which is on average maybe £5,000 if you're in the UK. So you kind of make assumptions on your population. So we looked at what's the percentage female versus male in the organisation, what's the location geographically, and based on that, and knowing that 1 in 6 couples have fertility struggles, then you actually can infer that that's going to be roughly the percentage of people taking it up. So for us, it was overall like a £25,000 investment that was really really worth it initially, because we're taking this in small steps. So we launched the informal network, then we established the relationship with Fertifa, who helped us with offering membership and free membership and sort of discounts to people. Then we actually offered the fertility test kits. So that's the next step. And then the following step after that will be starting to actually look at how we pay for people's treatment. So that's obviously a much bigger investment, £5,000 when you have 18,000 employees. Obviously you don't multiply by 18,000, but you make those assumptions, and you have to build that in we have a healthcare trust. And so we'll, bed it into the offering with tax implications for employees. So you have to look at that, and how much you're prepared to sort of impact on the tax elements, the taxable element and things like that. So that's what we're currently looking at with HR. But like I said at the beginning, I'm not from HR at all. I'm just here as a sort of
the ambassador.
SME. Yeah, I'm an ambassador. And I try to influence for HR people to speak to Fertifa with the sponsoring of my director, my exec sponsor for the network. And all of that is happening just as you influence it. So I think that's why it's so easy. And usually employers just think it's a slam dunk. Like when you look at the loyalty that you're going to get, it's a tenfold investment, return on investment.
And if it's helpful, I can offer sort of the view from the Fertifa point of view, and like Hortense is our best. We should pay her commission really, but she's not only an ambassador within Centrica, but for the Fertifa partnership, and we couldn't be more grateful for that partnership. But in terms of the test kits, and because of the feedback through Centrica employees and other clients, employees who have taken them up, we also offer obviously advisory conversations before and after those test results come in. So as somebody was mentioning in the chat, it's more than just the diagnostics. A lot of times it's actually the care, the sort of well-being support alongside this journey, even when it's just an exploratory sort of exercise. The other point I wanted to pick up on is we see sort of across the board of our set of clients that just for people who might be thinking about the cost and again the business case, that typically if you're looking at all the resources that we make available and that Hortense has also done for her organization, whether it's resources, guides and toolkits, we see across the workforce probably about 10 to 15% take up at some point in someone's sort of tenure at the company, whether they're going to access one of those pieces, attend a webinar, attend a lunch session or a brown bag or otherwise, or even go through some sort of treatment. On the treatment side, if you're talking about fertility specifically, it's pretty low, as Hortense was saying now, looking at sort of 1 to 2% take up across the entire employee population for doing invasive treatment. But as also was mentioned in the chat or asked in the chat, companies like ours, it's not just Fertifa, will also offer support for non-invasive treatment as well. And that's just as important. And as Hortense was saying, you get your return tenfold because of employee retention and of course recruitment in the first place and the ability to attract talent, but that loyalty that's fostered. But we're also seeing there's genuine benefits to the bottom line in terms of most of the workplaces will have some kind of medical cover. And we see that obviously if people have support during a fertility journey, they are less likely to have complications, less likely to require longer hospitalization, less likely to have multiple births. And so you actually do save money on the outlay that you would otherwise be paying for the healthcare and the health cover of a journey that might not be supported. So even if a workplace said, okay, we don't really want to fund for employee treatments on fertility, and we want that to be employee funded, it probably ends up that from absenteeism, from missed work, from productivity, doctor's appointments, and from the longer care that's required, it might end up actually costing the workplace more in terms of actual health benefits and cover. So I just thought that would be, and yes, Crystal's pointing out in the chat, anxiety, depression leave, and sort of all that impact on productivity for sure.
Fascinating, Eileen. Thank you so much for that. And yes, absolutely. It's about thinking of the whole person. Gaia and Liv, interested in understanding what your networks are doing to support staff experiencing fertility challenges. And did you experience any barriers to setting up your policies or company-wide initiatives?
Yeah, I can take that one.
Thanks,
so
Liv.
we've got a variety of different networks. One of our networks is called Working Carers and Parents. And that group really helped us to start looking at what is it people need, albeit they weren't the group that actually helps start to formalize the ideas. We went and asked the business who feels like they can share their personal experiences, either anonymously to the people team or in a 6-7 person chat group. We did experience barriers. We experienced barriers because of financial constraints, which I'm sure every organisation is under. So what we really wanted to introduce originally was support with funding the IVF treatment. So we wanted to be able to support at least one round of IVF treatment per employee that was asking for it. And some of our employees are couples. So what we wanted to do was offer them either one per person or two, depending on their mental state at the time of what they wanted from us. But unfortunately, due to financial constraints, we couldn't do that at the time. We hope in the near future that we can offer that. So instead, we then need to look at how can we financially fund time off, and how can we look at what support is at our disposal at the time of introducing the policy. So there were a few barriers that we had to overcome with what we really wanted to introduce versus what's the reality and what can be sustainable for the organisation to continue to offer to everybody. We didn't want it to be just for people of certain tenure or certain positions. We wanted it to be for new hires, tenured hires across the board.
Thank you, Liv. One of the really interesting questions, well, I think it's really interesting questions, is here, so both for Hortense and maybe Eileen and Gaia, how much engagement have you all had from male staff, but both as members, i.e. staff team, or partners of the staff team? Has this been a challenge? And if it has been a challenge, do you have any guidance in trying to get them more involved?
I'm happy to start. So obviously when we work with our workplaces, and I was just actually typing back to John, who I think posted that question, we make sure that in educating the workplace, the HR people teams, and also line managers, that actually in the UK, more than 40% of fertility challenges are related to male factors. And so this isn't, a female or a male issue, it's a reproductive health issue, and obviously relating to family forming more broadly. And of course, to the extent that there are same-sex couples, so you can have a male-male couple, you're clearly wanting to make sure that they're aware, the employees are aware of the services and the provision and the support as well. So we work really hard and try to spend as much time as possible, a lot of that through the process of working with Hortense and learning from her as well, to make sure that the comms we provide to clients actually clarifies all of that. We also encourage workplaces to provide the support and the provision to employees and their partners if they have them, which is another way to go about it. But obviously, even things like preservation, that applies as much to sperm preservation as it does to egg preservation. And talking about sperm motility and doing all that testing, and again, the exploratory process is as applicable to men as it is to women. So we do try to make sure that the workplace is aware of that, signposts that, and makes it, a communication that's digestible and going to be attractive to men as well. This is not just a single sex issue.
Thanks, Eileen. Gaia, did you want to add anything?
Sure. I'd also echo exactly what Eileen said with our fertility policy, which you've just heard about. It obviously provides that time off, not just for the individual undergoing treatment. It was really important for us to provide that support for partners. So it's 5 days off per cycle, so up to 15 days in total. And again, in terms of I don't think we've necessarily looked at it from a gender perspective, but moreover, what support can we call them client leadership teams, so essentially the senior team members that look after our various account teams, what support can we provide them in navigating our various policies? And part of that is we're hoping to introduce mental health and wellbeing training this year. And that, I think, beyond kind of fertility, that's going to be really impactful for us. So those are some of the things that we're doing.
Super. Thank you, Gaia. Hortense, do you have anything to add about that, the issue of a potential gender split?
Yeah, I think it's a very, very unfortunately too common one that, and you can see from this forum, we're mostly women, but it is a half and half situation really, where male infertility is as important, unfortunately, in terms of experience and the issues, the challenges that they might have, the medical implications and all of that. So I think it's really important to show and share very openly that, this is not just a female issue. And as a consequence, my co-chair has been for the last couple of years a man. Our executive sponsor, our HR director, is a man as well. And he was the one sharing actually his experience of infertility and having to go through IVF, etc. So it's keeping in touch with that, in sync with what's going on, because when you look at clinics, and usually it's mostly women in there, or the partner's coming, but it's not really usually. I mean, it's evolving, but usually it has been, in my own experience over the last few years, it has been all the communications, everything is aimed at the women. And then there's like this little piece of paper like scribbled together and put on a board somewhere, and that if you're a man, you know, you can call us here, there's a hotline. But it's just a shame, because it impacts them so much, and they're not so from experience, they're not so quick to share with others. And so we need to also create those special forums. And I believe there are forums for men only, like on Facebook, etc., so that they can open up with themselves. But I love that when in our network, our sanctuary, men actually come in and ask questions and ask for advice or share their own experience and share and help themselves. So they buddy up between men. So that's really wonderful that when that happens.
Fantastic, thank you. Interesting question. This may not be an issue for any of you, but how do you prevent misinformation being shared within a fertility network?
Well, I would like to say that this is really why I thought it was so important to work with Fertifa. From our perspective, I was seeing, you know, people sharing their own experience and asking questions like on medical things or treatments, and I was feeling really uncomfortable, because you don't know whether that's going to work. If it worked for you, is that really the right thing for someone else? Is that actually a treatment that's been proven to work? You know, or is it something that is really, you know, effective? And so I always wanted someone to come in and give the true picture of things, you know, the real information. And so Fertifa have actually been onboarded not only within our organization, but in the group, in the Teams group, so they can answer questions as well and participate in the chat. And I found that really, really helpful, at least to reassure us that, you know, if anything's going out there, but I haven't really seen anything other than just, you know, sharing your own treatment or something that has worked for you. But is that going to work for everyone? You don't know. Yeah.
Great, thank you. Would anybody else like to add anything in there about that? No. Okay. So one of the questions again in here is supporting employees who've gone through a stillbirth. Gaia and Liv, would you like to pick up on that one?
I'm happy to take this one. So at Thoughtworks, although we're not working with an external partner who specialises in fertility, we do have an array of benefits, so including kind of private medical insurance, and that as part of that plan, we're able to access nurses and GPs and really kind of to assess what treatment is needed and specialist treatment. Again, as part of our employee assistance program, we're able to access counselling. So that's also important in terms of providing that face-to-face support and having someone who is going to be able to provide, whether it's to do with relationship and family matters and grief and bereavement. So providing that kind of really specialist care. The people team, it's ourselves, we've undergone kind of some training with the mental health charity Mind, and we've extended that also with to our mental health first aiders and other key members within the organisation. So really kind of providing that support for when employees are at work. And you know, it's really hard, right, like now that we're working remotely, to be able to just kind of separate your work and personal life. So really how we can integrate that and have those kind of more personal conversations. But again, kind of echoing what Hortense said, is just really being key to making sure we're providing the right advice and knowing when we can kind of direct the employee to whether it's, you know, our various benefits or perhaps external organizations and charities. So we've also linked all of those to our policy so that we can kind of make sure that all of our employees are supported. Liv, have I kind of left something off?
Yeah, I think it's worth mentioning that for stillbirth specifically, we offer the full maternity leave offering. So if it's prior to 24 weeks, it would fall under the miscarriage umbrella of our fertility policy. But anything post 24 weeks is what the NHS state. We do offer the full maternity policy, so 6 months full pay. And we as Gaia said, we very much encourage them to the individual to look at working with either the charities we're partnering with or the mental health benefit providers that we've got, because we want to focus on emotional and physical well-being, but the time off would equate to the maternity leave policy.
Thank you, Liv. That's really helpful and very, very good to know. The final question that I'm going to put to you is about smaller organizations and also in larger organizations. If there is an individual who feels passionately about this, can you offer them some guidance about how they might go about setting something up where, if there isn't an existing HR policy and if there's not a lot of money floating around? Have you got any guidance that you would use either, as I say, for those individuals or for smaller organizations? And I think Hortense, thank you.
Definitely. I mean, whether your organization is big or small, you will always find, unfortunately, because of because it's such a common issue, you'll always find someone who's either directly impacted or knows somebody who has, and it matters to them to do something about it. And even it could be the mother of someone going through infertility wanting to find out what to do about it, like how to support her daughter or son. And so there's always going to be someone passionate about it. Use that person and create, whether it's a small group, just informal, group for people to meet up regularly, have drinks. We've had like sort of drink your sorrows after a failed IVF kind of drink, at the bar next to the office or things like that. It can be very informal. It doesn't have to be something that's part of the benefit, etc. But even just that, just knowing you have some colleagues that empathize is amazingly important. And then for when we have more than 19,000 employees, that means quite a lot of people. Potentially, and it's an online forum, so I can actually see the numbers. And since we started in 5 years ago, I can't tell you how many people in total have joined, because it's a flowing. It's really like there's a turnaround of people that come in, join, have their babies when it's successful, and then they join the working parents network that we've also set up. So they come and go. But on average, over the last 5 years, I've always had a minimum of 150 people join at any time.
Brilliant. Hortense, so thank you.
It's really, you'll have in the hundreds, but potentially in the thousands of numbers. Yeah.
Thank you. Gaia, Liv, within a smaller organisation, I know Thoughtworks isn't tiny, but what guidance can you provide?
I think echoing exactly what Hortense stated, I think what really worked for us was how could we get people talking about the subject. So beyond kind of the focus groups that we created and putting a real call out on our town hall to say, this is the work that we're doing and who wants to be involved and really kind of engaging not only employees, but our leaders. So again, what Liv mentioned earlier was working with our CEO at the time to really kind of sponsor and drive the initiative. That was really huge for us. Again, we have a program, we call it Thought Worker Stories, but essentially it's written accounts which can be either submitted anonymously or if you're free, if you want to share, you can kind of do that quite openly, and the written account shared across the UK wide organisation. And there I think it was just really great because we had people respond who were at leadership level and say this is my personal experience and this has happened to me, or this has happened to a family member. And I think that really kind of drove home the message about this is important, this is something that we really care about. And beyond that, I think, having our speakers corner sessions, so they're weekly sessions where any employee in the business and external organizations can come and talk to our employees about any subject. And we had that for in terms of fertility, we had external organizations like Fertifa who came and spoke to thought workers here, as well as individuals in the business sharing about their own story. And from that, I think it really kind of engaged employees about what else can we do and to join us on this journey. I think we're definitely starting, and it's something that we're going to hopefully grow and just be able to offer more and more.
Brilliant. Thank you.
And I think it doesn't have to be big, as long as you help one other person, it makes it
exactly. And I think even just from kind of the focus groups, there were individuals who didn't know that there were other individuals going through this. And of course, they can go off and have their own conversations, or have someone almost like a buddy of, who can I go to at work that I trust and feel confident in, and, have those conversations.
Thank you all so much. We've got a minute to go. So there are two things that I want to say, three things really. One, thank you all so much. Two, somebody's actually mentioned SANDS, SANDS.org.uk, provide really extraordinary support for people. So if you want to go and have a look at that. Most importantly, from our perspective, thank you all for attending. Huge thanks to our panelists. And please do look out to our link to a free HR toolkit on this subject, which we are going to be emailing you. We're really delighted to send that all to you. We're feeling very, very well supported by Fertifa. So thank you very, very much indeed. That link will also contain details for Fertifa and also for Working Families, our employer team here, if you'd like to discuss anything with them. I look forward to welcoming you to another webinar soon. Thank you all so very much. Absolutely delighted. Thank you. Bye-bye.